Diazepam. Expanded lecture notes. Diazepam, a cornerstone in managing anxiety, seizures, and more. Diazepam, a widely recognized benzodiazepine, is a critical tool in clinical practice. With its potent anxiolytic, sedative, muscle relaxant, and anticonvulsant properties, diazepam plays a vital role in managing acute anxiety, seizures, muscle spasms, and as a premedication for procedures. Understanding diazepam's applications, benefits, and considerations is key for effective and safe use in patient care. Introduction. 1. Diazepam is one of the oldest and most widely used benzodiazepines, known for its anxiolytic, sedative, muscle relaxant, anticonvulsant, and amnestic properties. This means diazepam helps reduce anxiety, causes sleepiness, relaxes muscles, stops seizures, and can cause memory loss of events. 2. It is still used in ICU, anesthesia, and emergency care, although its long duration and active metabolites limit its use for continuous sedation compared to newer agents. This means diazepam is used in critical care settings but might not be ideal for long-term sedation due to how long it lasts and its breakdown products in the body. Definition. Diazepam is a long-acting benzodiazepine that enhances GABAergic neurotransmission in the CNS, producing a range of effects from sedation to anticonvulsant activity. This means, diazepam is a type of benzodiazepine that lasts a long time in the body. It works by boosting the effects of GABA, a calming neurotransmitter, in the brain. This leads to effects like sedation, calming, sleepiness, and stopping seizures. Classification of diazepam. 1. Pharmacological class. Benzodiazepine. This means diazepam belongs to a group of drugs that act on the brain and nervous system to produce calming effects. 2. Therapeutic class. Sedative, hypnotic, anxiolytic, anticonvulsant, muscle relaxant. This means diazepam is used to calm or sedate, reduce anxiety, stop seizures, and relax muscles. 3. Controlled status. Schedule 4 in most countries. This means diazepam has some potential for abuse and dependence, has accepted medical uses and lower risk compared to Schedule 1-3 drugs. Chemical properties. 1. Chemical name. 7-chloro-1, 3-dehydro-1-methyl-5-PHENYL2H-1, 4-benzodiazepine-21. This is the formal name describing diazepam's chemical structure. 2. Molecular formula. CHClNO. This shows the atoms making up a diazepam molecule. 3. Molecular weight. 284.74 grams per mole. This is the mass of one molecule of diazepam. 4. Structure. Benzodiazepine core with phenyl and chloro substituents. This means diazepam has a basic benzodiazepine structure with added groups that affect its action. 5. pKa, approximately 3.4, weakly acidic. This indicates diazepam's acidity level in a chemical context. Physical properties of diazepam. 1. Appearance. White to light yellow crystalline powder. This describes how diazepam looks in its pure form. 2. Solubility. Practically insoluble in water, soluble in alcohol and propylene glycol. This diazepam doesn't dissolve well in water but does in certain other liquids used in formulations. 3. Formulations. Oral tablets, oral solution, rectal gel, injectable solution, propylene glycol base. These are the ways diazepam is prepared for medical use. 4. Stability. Light sensitive, store at room temperature. This means diazepam should be kept away from light and stored at normal room conditions to maintain its effectiveness. Mechanism of action. 1. Binds to the benzodiazepine site on the GABA receptor complex in the CNS. This means diazepam attaches to specific spots on receptors in the brain and nervous system. 2. Increases the frequency of chloride channel opening events in response GABA. This means diazepam boosts the effect of GABA, a calming neurotransmitter, by helping channels open more often. 3. Causes neuronal hyperpolarization leading to inhibition of neuronal firing. This means nerve cells become less likely to fire, leading to calming effects. 4. Produces sedation, anxiolysis, anticonvulsant activity, muscle relaxation, and amnesia. These are the resulting effects of diazepam's action: calming, reducing anxiety, stopping seizures, relaxing muscles, and causing memory loss of events. Pharmacokinetics. 1. Absorption. Rapid after oral, IV, or rectal administration. This means diazepam gets into the bloodstream quickly no matter how it's given. 2. Distribution. Highly lipophilic leading rapid CNS entry, then redistribution to fat and muscle. This means diazepam enters the brain quickly because it dissolves in fats, then moves to body fat and muscles. 3. Protein binding. Approximately 98%. This means most diazepam in blood is attached to proteins. 4. Metabolism. Hepatic via 2 cypriot pounds C19 and 3 cypriot pounds A4 leading to active metabolites, desmethyldiazepam, temazepam, oxazepam. This means diazepam is broken down in the liver to other active substances. 5. Elimination. Re-excretion as conjugated metabolites. This means diazepam's breakdown products leave the body in urine. 6. Half-life. 20 to 50 hours, active metabolites up to 100 hours. This means it takes this long for half of diazepam, or its active products, to leave the body. Pharmacodynamics. 1. Onset, IV, 1 to 5 minute. This means effects start quickly when diazepam is given through a vein. 2. Onset, oral, 30 to 60 minute. This means effects start within an hour when taken by mouth. 3. Duration. Sedation 12 to 24 hours. Anticonvulsant effect longer due to active metabolites. This means calming effects last up to a day, and seizure control can last longer. 4. Effects. Sedation, anxiolysis, muscle relaxation, anticonvulsant, retrograde amnesia. These are the effects diazepam has: calming, reducing anxiety, relaxing muscles, stopping seizures, and causing memory loss of events after taking it. Clinical uses. 1. Anxiety disorders. Diazepam helps reduce anxiety in certain conditions. 2. Status epilepticus and acute seizures. Diazepam is used to stop prolonged or severe seizures. 3. Preoperative sedation and anxiolysis. Diazepam was used before surgeries to calm patients. 4. Muscle spasm due to neurological or musculoskeletal disorders. Diazepam helps relax muscles in certain conditions. 5. Management of alcohol withdrawal. Diazepam can help manage symptoms of alcohol withdrawal. 6. Procedural sedation, less common now due to long half-life. Diazepam was used for sedation during procedures but isn't as preferred now due to how long it lasts. Use of diazepam in ICU. 1. Seizure control in critically ill patients, status epilepticus. Diazepam can stop severe seizures in very ill patients. 2. Adjunct for muscle spasm in tetanus or severe spasticity. Diazepam helps relax muscle spasms in certain conditions. 3. Rarely for continuous sedation due to accumulation and prolonged recovery. Diazepam isn't usually used for ongoing sedation in ICU because it builds up in the body and takes a long time to wear off. Do you want to know more about managing status epilepticus in ICU settings? Alternatives to diazepam for sedation in ICU. Considerations for using benzodiazepines in critically ill patients. Use of diazepam in anesthesia. 1. Premedication for anxiolysis and sedation before surgery. Diazepam was used before surgeries to reduce anxiety and calm patients. 2. Adjunct for muscle relaxation in certain procedures. Diazepam can help relax muscles during some surgeries. 3. Not commonly used for induction due to slower onset than midazolam or propofol. Diazepam isn't typically used to start anesthesia because other drugs work faster. Use of diazepam in emergencies. 1. First line for status epilepticus, IV bolus. Diazepam is often given through a vein to quickly stop prolonged seizures. 2. Control of severe agitation or anxiety crisis. Diazepam can help calm anxiety or agitation in emergencies. 3. Acute alcohol withdrawal with risk of seizures. Diazepam helps manage alcohol withdrawal when seizures are a risk. 4. Management of hypertonicity in tetanus. Diazepam helps relax severe muscle stiffness in tetanus. Administration and dosage of diazepam. 1. Status epilepticus. IV, 0.15–0.25 mg per kilogram, max 10 mg per dose, at 5 mg per minute. May repeat in 10–15 minutes, max 30 mg in 8 hours. This is how diazepam is given for severe seizures. 2. Anxiolysis, sedation. Oral, 2 to 10 mg 2 to 4 times daily. This is typical dosing for anxiety or sedation by mouth. 3. Anxiolysis, sedation. IV, 2 to 10 mg every 3 to 4 hours as needed. This is dosing for anxiety, sedation via injection. 4. Muscle spasm, tetanus. IV, 5 to 10 mg initially, then 5 to 10 mg every 3 to 4 hours as needed. This is how diazepam is for muscle spasms or tetanus. Side effects of diazepam. 1. Drowsiness, fatigue. Diazepam can make people feel sleepy or tired. 2. Confusion, ataxia, dizziness. Diazepam can cause problems with coordination, balance, or thinking clearly. 3. Respiratory depression, especially with opioids or rapid IV injection. Diazepam can slow breathing, particularly if given fast through a vein or with other drugs like opioids. 4. Hypotension. Diazepam can lower blood pressure. 5. Muscle weakness. Diazepam can cause muscles to feel weak due to its muscle relaxant effects. Serious side effects of diazepam. 1. Respiratory arrest, rapid IV administration. Giving diazepam too fast through a vein can stop breathing. 2. Hypotensive collapse. Diazepam can cause a severe drop in blood pressure in some cases. 3. Paradoxical reactions, agitation, aggression, hallucinations. Some people react to diazepam with unusual behaviors like agitation instead of calmness. 4. Tolerance, dependence, withdrawal seizures. Using diazepam long-term can lead to needing more effect, dependence, and seizures if stopped suddenly. 5. Propylene glycol toxicity with prolonged IV infusion, metabolic acidosis, renal failure. Using diazepam IV for a long time can cause problems due to the propylene glycol in the formulation. Contraindications of diazepam. 1. Hypersensitivity to benzodiazepines. Diazepam shouldn't be used if someone's allergic to benzodiazepines. 2. Severe respiratory insufficiency, unless ventilated. Diazepam can worsen breathing problems unless the patient is on a ventilator. 3. Acute narrow-angle glaucoma. Diazepam can worsen this eye condition. 4. Myasthenia gravis, relative contraindication. Diazepam can worsen muscle weakness in myasthenia gravis, so caution is needed. Precautions with diazepam. 1. Elderly or debilitated patients, reduce dose. Diazepam can have stronger effects in these patients, so lower doses are often used. 2. Hepatic or renal impairment, risk of accumulation. Diazepam can build up in the body with liver or kidney problems. 3. History of substance use disorder. Caution is needed with diazepam in patients with a history of addiction. 4. Avoid abrupt withdrawal after long-term use. Stopping diazepam suddenly after long-term use can cause withdrawal symptoms. Advantages of diazepam. 1. Long anticonvulsant effect, ideal for prolonged seizure control. Diazepam's effects last long for controlling seizures. 2. Multiple routes of administration: oral, IV, rectal. Diazepam can be given in different ways. 3. Effective muscle relaxant in spasticity and tetanus. Diazepam helps relax muscles in certain conditions. 4. Well-known safety profile from decades of use. Diazepam has been used a long time, so its safety is well understood. Disadvantages of diazepam. 1. Long duration may delay recovery in ICU or post-procedure. Diazepam's long-lasting effects can slow down recovery. 2. Active metabolites: right-pointing arrow, prolonged sedation in elderly and organ dysfunction. Diazepam's breakdown products can cause prolonged sedation in some patients. 3. No analgesic effect. Diazepam doesn't relieve pain. 4. High risk of dependence with chronic use. Using diazepam for a long time can lead to dependence. Clinical considerations for diazepam. 1. For emergencies, IV is preferred for rapid onset. Giving diazepam through a vein works fast in emergency situations. 2. Rectal gel useful for out-of-hospital seizure control. Rectal diazepam is a good option for controlling seizures outside hospitals. 3. Monitor closely for respiratory depression. Diazepam can cause breathing problems, so patients need to be watched carefully. 4. Avoid long-term continuous infusion in ICU due to accumulation. Using diazepam for a long time in ICUs can lead to buildup in the body. 5. Flumazenil is the reversal agent. Use with caution in chronic benzodiazepine users, may precipitate seizures. Flumazenil can reverse diazepam's effects, but caution is needed in patients used to benzodiazepines because it might cause seizures. Comparison of diazepam with other agents. 1. Onset, IV. Diazepam, 1 to 5 minute, lorazepam, 5 to 20 minute, midazolam, 1 to 5 minute, propofol, 30 seconds. 2. Duration. Diazepam, 12 to 24 hours, lorazepam, 6 to 8 hours, midazolam, 1 to 2 hours, propofol, 5 to 10 minute. 3. Active metabolites. Diazepam, yes; lorazepam, no; midazolam, no; propofol, no. 4. Seizure control. Diazepam, excellent; lorazepam, excellent; midazolam, good; propofol, poor. 5. Accumulation risk. Diazepam, high; lorazepam, moderate; midazolam, moderate; propofol, low. Additional information about diazepam. 1. Propylene glycol in injectable diazepam can cause metabolic acidosis and renal toxicity during prolonged infusions. This is a risk with long-term IV use of diazepam. 2. Rectal diazepam, Diastat, is commonly used for out-of-hospital seizure management, especially in children. This is a way to give diazepam when IV access isn't available. 3. Preferred over midazolam in some seizure protocols due to longer anticonvulsant effect. Diazepam's longer effect can be advantageous in certain seizure management situations. Current trends. 1. Declining use for routine sedation in ICU due to prolonged effects. In intensive care units, ICUs, there's a trend away from using benzodiazepines like diazepam for routine sedation. This is because of concerns about prolonged effects, which can lead to longer stays in the ICU and potential withdrawal symptoms. 2. Still preferred for status epilepticus, tetanus, and severe spasticity. Despite the declining use in some areas, diazepam remains a preferred treatment for severe conditions like status epilepticus, a severe condition tetanus, and severe muscle spasticity. Its effectiveness in quickly managing these conditions makes it a valuable option. 3. Increasing interest in rectal and intranasal benzodiazepines for rapid seizure control outside hospital settings. There's growing interest in using intranasal formulations of benzodiazepines like diazepam for quickly controlling seizures in settings outside of hospitals. These methods can offer rapid absorption and ease of use in emergency situations. Conclusion. About diazepam. 1. Diazepam remains a cornerstone drug for seizure emergencies and muscle relaxation, but its long half-life and active metabolites limit its use for short-term sedation in modern ICU practice. Diazepam is still very useful for treating seizure emergencies and for muscle relaxation, but its long-lasting effects make it less ideal for short-term sedation in ICUs. 2. It is best reserved for specific indications where prolonged anticonvulsant or muscle relaxant effects are desired. Diazepam is most appropriately used in situations where its long-lasting effects for controlling seizures or relaxing muscles are beneficial. Diazepam is the veteran of emergency sedation, reliable, long-lasting, and always ready when the crisis demands endurance. Critical care practice principle. This suggests that diazepam is a trusted and effective medication in emergency situations requiring sedation, like ear seizures or extreme muscle spasms. Diazepam's long-lasting effects can be beneficial in crises where prolonged control of symptoms is needed. Thank you for watching. If you liked this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.